I hope you can hear me. I would also like to thank Dr. Robinson and Dr. Omaso for the opportunity for us to link internationally. Basically, our input is going to be limited to our experiences of health worker migration. However, the approach is more to characterize migration because in our own situation, the challenge is mainly migration from the rural areas to urban areas, migration from the public sector to the private sector, and of course, migration out of the country, mainly to developed countries in Europe and North America. Now, the challenges we have are to address both the push factors and the pull factors. And the pull factors usually are a little bit difficult to deal with because mainly they would be dealing with the level of remuneration and maybe the career opportunities that our professionals have abroad. However, from the push factor side is the question of remuneration, the question of career paths, and dealing with local issues like the quality of management, equipment, availability of medicines, and so on. And of course, the broader issue, which is a perception as to whether the professionals feel valued or not. Therefore, our approach is addressed towards addressing those issues. And I would like to add on top of that, in terms of the approaches that we have put in place, one is to make sure that we've got policies and programs in place to address those. In fact, we are currently running a very successful program where we've looked at how we address in the nursing fraternity the issue of remuneration and the career progression mechanism, all put in one so that we can be able to give recognition to the experience, education qualifications, and so on, coupled together with improving remuneration within the public health sector. And already, although it's still early stages, we are noticing that there is a significant movement of the nursing professionals back into the public health sector. Of course, the major concern has always been the loss of the experienced professionals. Now, the other issue to touch on is the impact of donor and partner and development partner, actions. Because, like it has been stated before, sometimes the non-governmental bodies that employ professionals end up paying far much more than what governments are able to pay. And certainly there are discussions that go on around that because our view is that there needs to be a focused, trust as a country as to how we deal with these challenges. The other issue is the steps that we take to discourage, a situation where the majority of health professionals from neighboring countries would actually want to come and work in our own country simply because of a stronger economy or better conditions. It's usually not a very easy, policy to stick to. But I'm proud to say that we've tried to stick to that in South Africa as much as possible. In terms of implementing other, policies, it's one of the flagships has been our memorandum of understanding with the United Kingdom, which was really based not only on capping migration, but also to find ways in which the United Kingdom could assist in the strengthening of our health system. Therefore, that would be able to have structured movement of our professionals, would have cooperation beyond, issues of migration, that also we could be able to address some of the local problems we have that are similar, to what the United Kingdom might have. So just in brief then is to say that our approach is multi-pronged. One is to address the push and pull factors. The other one is to address internal issues that relate to the conditions under which our own professionals, have to work. And more importantly also is to address the issue of education and training. our capacity to produce more professionals to be able to meet our needs. I will end there and be able to take some questions later on. Thank you.
Thank you.